Hi, I'm Kirsty Cullen, CEO at the Optimum Health Clinic, and today I'm joined by Sara Jackson, who is our Director of Nutrition at the clinic. Good morning, Sara.
Good morning, Kirsty.
So, as promised, the Optimum Health Clinic team will be bringing you bi-weekly videos over the coming months. And really the key aim is to ensure that our fatigue community have regular access to resources and support via our social media channels. So the team have been working hard to create a mix of content that we hope you will find both informative and interesting. And the short videos are set to cover a range of topics, ranging from discussing the mind-body connection, looking at key functional body systems. We'll also be doing some research reviews and an overview of key psychology tools. And then some of the nutrition team will be stepping into the limelight with some practical food demonstrations, which should be fun. So there is a lot to look forward to. And Sara, perhaps you could talk us through what our initial focus is going to be.
Sure. So specifically, we're going to start off with supporting our immune system through food. And we've got a really good recipe that's coming your way really soon. Then we're going to do a 3-part COVID series. We're starting off with cortisol and the impact of stress, both on long COVID. But what we find is this applies to our ME/CFS clients very much so as well. Then we're going to look at tips and tools that we can use to manage our stress. And we're going to be joined by Jess, who's head of our psychology department, which will be really useful. Then we move on to inflammation and the context within long COVID as well as ME/CFS. And we're going to do a practical demonstration on anti-inflammatory foods. Then we're going to look at the gut ecology and the microbiome and how that's impacted on long COVID as well as ME/CFS. And we're going to do a practical demonstration of fermented foods, which will be really, really useful tools and tips everyone can try at home, as well as trying to make the science applicable to everybody.
And long COVID has really brought an unprecedented focus on all conditions that are relative to post-viral fatigue, I think. And as we discussed in our video last week, long COVID still remains officially diagnostically distinct from ME/CFS, so that's very important to say. But it appears that long COVID shares many underlying clusters of symptoms with ME/CFS. Sara, perhaps you'd like to say a little bit more about where some of those key symptom overlaps occur.
Yeah, sure. So we found a really good graphic that we'd like to share with you to sort of make this come alive a little bit. So we've got this graph by Dr. Natalie Lambert and the Survivor Core that was put together last year at the Indiana School of Medicine. And what they did was survey over 1,500 patients to elucidate the top 50 most common symptoms with long COVID. So if we take a little look at that graph, we can see lots of commonalities between long COVID symptoms and what we've been seeing for many, many years with our CFS ME clients. Things like upper back pain, things like constant thirst, nerve sensations, tinnitus, sharp or sudden chest pain. These are things that we know and we have been supporting people with for many years. So that's where our expertise and our experience in this comes into play with long COVID.
And it's important to say, isn't it, that not everybody who has a viral infection or even COVID-19 actually will go on to develop long COVID, ME or CFS. The evidence suggests that there might be some common risk factors associated with the development of long COVID, and also there might be some helpful post-infection health management strategies which will prove helpful in the management of fatigue. So the long COVID series aims to look at some of those topics. Sara, we've been doing a lot of research, haven't we?
We spent many hours trying to stay on top of it because we're really committed to reviewing the emerging evidence base around long COVID. And this long COVID series will delve into some of that research, along with looking at these tools and tips that people will find helpful to do themselves at home.
And I think it's fair to say, consequently, we feel quite uniquely positioned at OHC, given our existing experience in post-viral fatigue. And as we continue to support our ME/CFS community, we will also now be extending our provision to support those people with long COVID. So we look forward to sharing more information with you over the coming weeks. So do watch out on YouTube, Facebook, Twitter, and of course, our website. And we'll look forward to seeing you soon.
See you soon.